We have Dr. Sonawalla with us, and today we'll be discussing about different aspects of human behavior and how it affects the society as a whole.
Welcome, ma'am.
Thank you.
Ma'am, in your opinion, why do you think there is an increase in the number of students suffering from depression these days?
There are a number of factors responsible for this, starting with the age which the students are at. So, in the late teens and in early adulthood, individuals are more prone biologically to developing a mood disorder, especially depression. Second, the stressors which students face are very, very many and unique to college life. For example, a lot of students are unable to sleep enough, get enough sleep. They juggle so many different activities, from technology to academics to sometimes financial pressures, to keeping up with a fantastic social life. I believe it's fashionable to have over an X number of Facebook friends, be it 500 or 1000. So giving time for all of these activities, and then the need to excel. The atmosphere is also increasingly more competitive, and there is a huge amount of peer pressure, correct me if I'm wrong there, to keep up with one another. So all of these factors make an individual more prone to developing depression in the college years, and this of course is combined with a unique biological vulnerability at this age, where the hormonal changes have taken place and the chemicals are sort of just can go into an imbalance. So which is why students are at a higher risk.
Ma'am, do you think in a course like MBA, greater stress and impetus should be laid on subjects like organizational behavior and psychology?
I think so. I think first of all, in any college setting, it is a good idea to incorporate organizational psychology, and especially in MBA, because you're not just going to be managing yourselves, but also a lot of people around you. Be responsible for large corporates. Many students from this course will become very successful CEOs. And it's a good idea to have a basic understanding of human psychology, which can go a long way in helping one understand one's moods, helping one understand the moods of one's colleagues and peers, families, friends, and with doing very little, just by being aware and helping someone at the right time, one can make a huge difference in that individual's life by taking very, very simple measures.
Ma'am, according to you, mood swings are inherent in our nature, or are we conditioned to it?
That's an excellent question. Let me start by saying that mood swings are normal. If you are human, you're going to have mood swings. If somebody said to me, I don't have any mood swings, I'd start to worry. What's wrong with this person? So for example, when someone dies, we feel sad. When a good thing happens, we feel happy. When you get promoted or get good marks in your exams, you're thrilled. So this is completely normal. However, in certain individuals who have a mood disorder, such as depression or bipolar disorder, which is extreme mood swings from highs to lows, there is a chemical imbalance in the brain. There is a vast amount of research in this area conducted globally. And certain chemicals are responsible, such as norepinephrine, serotonin, dopamine. So these go into an imbalance for some reason in certain individuals. Genetics plays a very important role. So if one member of the family has a mood disorder, then other members are also very likely to develop the illness. Just as diabetes or heart disease can run in families, so also depression and bipolar disorder can run in families. There are other factors which can trigger a mood disorder as well, such as stress. Now, stress and life events are not a cause of the disorder, but they can merely set it off. Just as if a person, let's say, has a major financial loss and he has the gene for developing a heart disease, he's more likely to get heart disease. If somebody else has a gene for diabetes, that person is more likely to come down with diabetes. Likewise, if a person is has the gene for depression, is more likely to develop a depressive disorder or a bipolar disorder, as the case may be. Temperamentally, certain individuals are also more prone. So there are a vast number of reasons which are causes for mood disorders, and then the life stress events can act as triggers.
Can a negative attribute be converted into an asset?
All the time. The glass is either half full or glass is either half empty. Okay. So if you know that you have, let's say, depression, let's call it a negative attribute for the sake of this discussion. How does one convert it into something which is very positive? Let me tell you that some of the world's most creative people have had and have grappled with mood disorders and have talked very, very openly about it. Okay? Because the center for creativity, which is the right side of the brain, is also what is responsible for a mood disorder. So if a person is depressed, they might be able to write better, sort of write more effectively, get more poetic, paint better. All right. So it depends on how one uses that. Having said that, it becomes very distressful unless it is treated. So if it is treated correctly, appropriately, then one can use all of these in a very positive manner. Some of the world's most successful CEOs and businessmen grapple with bipolar disorder. Ted Turner, for example, has talked about this very, very openly. He's the founder of CNN, and he talked about this on his channel, about how he had bipolar disorder, didn't realize it, then got diagnosed and was treated with lithium, and that was with the mood stabilizer. And that stories like this can be very inspiring for people. So definitely something which one might think is negative can actually be converted, into not just feeling better, but actually, having a very, very positive outlook in life, and also helping a large number of people. Kate Jamieson Redfield is a doctor who has had mood disorders, has had a mood disorder, bipolar disorder, to be more specific. And she has written a book called Touched with Fire. If you want to learn more about bipolar, you must sort of read that book. It's a fabulous first-person account of the illness. And through this, she has been able to help so many people, millions of people. So certainly, everything has two sides.
Thank you, ma'am, for your valuable insight.
You're welcome.